Hi, everyone. My name is Caleb, and welcome to Conversations with Caleb. I am so happy to have one of my best friends and big sister, Ashley McElhaney, who is serving us right now on the front lines as a nurse in the Metro Atlanta area. So, Ashley, first, hello and welcome.
Hi, thank you so much for having me.
Of course. So, again, you are serving on the front line. So, tell us, how are you doing right now?
I am doing better than expected. It's hard seeing, everything that's going on right now, but I'm keeping my sanity. I'm praying all the time, but other than that, I'm doing really good.
That's good. So, tell us why you wanted to go into nursing in general.
I wanted to help people. That's what, everyone says, but that's really just the core of it. I wanted to be the patient advocate for people who may not be able to speak up for themselves or can't do for themselves. I wanted to be that helping hand to just help people overall through sickness, through death, through happy times, through wellness. I wanted to be a part of that. And also, I wanted to be another face in healthcare because I feel like in the Black community, we don't have a lot of representation. And I wanted to be a part of that as well.
Especially right now with this pandemic going on in Georgia, African Americans are the number one uh, race with the coronavirus. So, can you
Mhm.
talk about that? Because I think we both saw that there was this theory going around that African
Mhm.
Americans are immune to this because we didn't see African Americans getting this. But now, as you can see, we are at the top of the charts with this.
Yeah. So, we were seeing all over social media that Black people were immune. And at first, because we didn't know the severity of it, we were joking around with it. And now that's all that we see. And I think a lot of it is part of the socioeconomic factor. We have Black people, the Black community, we are riddled with diabetes and hypertension and obesity, respiratory issues. And because of that, it's making us a much more vulnerable target for the disease. And so now all you see are, for me, living in the Metro Atlanta area and working in a hospital in the Metro Atlanta area, I'm seeing mostly, Black individuals coming into the hospital with this disease. And of course, they are part of the elder population, and some are young. But when you look at their health history, they have the diabetes, they have the heart disease, they have all of these things that are making them more of a target. And so it's simply because of that health disparity that the Black community, especially, they just have to be more careful.
Yeah. So tell us, you just graduated from nursing school in December,
Hmm. Hmm.
and you and many other nurses are kind of like have been pushed
Yes.
headfirst into this pandemic. So tell us what you expected your nursing career to start off like and what you
Hmm.
are experiencing now.
I expected my nursing career to start off a little rough because I didn't have any, hospital experience coming in. So I knew that I was going to have a challenge, but there was nothing would have compared or prepared me for this. Um, it's hard and it's difficult because you're coming into the situation with very little knowledge, especially because we're fighting something that we can't see. And so, as a new grad, it's scary and it's new on top of just being a new career path anyway. But especially with a disease that is taking everybody by storm, it's affecting me as a new nurse, and it's also affecting nurses that are even more experienced. So we're all just being, taken by storm with this.
So what are the conversations like when you are around those nurses, whether you're in like the break room or just when you're together? Is it just like stay strong, or like what are you guys
Yeah.
saying to each other?
We're definitely trying to encourage each other to be, positive and to stay strong, but some of the experienced nurses, they have said that they've never seen anything like this. The only thing that you could compare the COVID-19 to was probably like the Ebola crisis, or, the swine flu, earlier, I guess, whenever that happened. But compared to the COVID-19, it's completely new to all of us. And so some of the experienced nurses, they are experiencing burnout, they're experiencing fatigue. However, because we have such a strong sense of community in the hospital, we have each other's backs. We're also getting community support in the Metro Atlanta area. And with all of that, it's definitely helping us to continue on with this fighting the coronavirus.
When did you first learn about COVID-19, and what did you think about it then?
So when I first heard about it, it was like my first or second week of nursing. I've only been a nurse for 2 months now, and it was under my understanding that at its worst, it was going to be like the flu, or it was going to be like pneumonia. And I was under the understanding that it was coming from China, and that people who are just traveling out of that country alone were the ones that were going to be affected. But just like any other disease that's being transmitted, it spread like wildfire. So in the Metro Atlanta area, I was starting to see more and more people trickling in, and then next thing you know, we just had a complete influx of people with the coronavirus by that time, it was probably my 3rd or 4th week of nursing.
Right now, we're seeing so many people who are dying from this and are just falling severely ill from this. So were you prepared for the aftermath of what you're seeing in the hospitals?
Not really, but I learned very, very quickly with this, because with the CDC and with our local hospital trying to educate people and prepare them, it was changing every single day. But I had to just learn to be more adaptable to it. So I wasn't as prepared first off, and I think now I'm more prepared to deal with, making sure that you are not cross-contaminating, your patients, and learning how to stay safe yourself, and all the different type of equipment that we have to wear going in and out of the rooms. And it's a lot of protocol, and it's a lot of policy changing, but you just got to learn to just go with it.
How are you all staying safe? Like, what are you putting on to shield yourself from possibly catching this?
We are wearing hair nets, and under the hair nets, we are also advising a lot of the nurses and other healthcare workers to wear, I guess you can call it like a surgical cap. So we have the surgical cap, we have the hair net, we have our goggles, we have or safety glasses, we have an N95. On top of the N95, we have a surgical mask. We have the protective gown. We have on shoe booties, and then we also double glove.
So you already said that with being in the Metro Atlanta area that you are seeing an influx or majority of African Americans who are coming in with this. What
Mm-hmm.
ages are you seeing with this?
I am seeing mostly 60s and 70-year-olds. It's unfortunate that we have some people coming in from the nursing home. So there might be like 80s in there as well. But the youngest that I've seen has been 30 years old.
And that's young. That's someone
Yes.
who still has a ton of
Yes.
life ahead of them.
Yeah.
So it's
Yeah.
not like only older people are getting this. This is people, we've seen people in their 20s, we've seen babies who have
Mm-hmm.
contracted this, so no one is exempt from the coronavirus.
Yeah.
So what are you all doing to treat these people, because there is no vaccine yet for this?
Right. So what we are doing, and I'm seeing a trend here, is we are treating them with fluids. If they come in asymptomatic, we treat them with the fluids. We treat them with antibiotics. And that's just because we want to make sure that if they develop a secondary disease, such as pneumonia, we want to make sure that that's going to treat that that disease or that illness. And then if they are symptomatic and they come in with the fever and the headache, we will keep them and we will just monitor like their oxygen rate, and we try to protect their respiratory system as much as possible. So that's going to involve giving them supplemental oxygen, because that's kind of the trend here. When they get to the point where they have shortness of breath, we know that it's only going to get worse from there. And so usually those people end up being on a ventilator, unfortunately.
So right now we're being told to social distance. What can you speak about when it comes to social distancing and the importance of it?
If I can say one thing and one thing only, I will stress the fact that social distancing will save a life. It is so important to follow the CDC guidelines as far as staying 6 feet away. I would even go to the point of wearing a mask. If you don't have a mask, a surgical mask, wearing a bandana, just wearing anything that is going to cover up your nose and your mouth. I know the CDC has mentioned that it could enter through your eyes, but I think your nose and mouth is what's the most important, and that's the main mode of transmission of the COVID-19. And make sure when get into your car, I'm kind of going off to something else here, but when you get into your car, making sure that you sanitize everything that you buy, sanitize your hands, and make sure that you are just staying as protected as possible.
And what about kids too? Because the few times that I've gone out, I have seen kids who are not wearing masks. I've seen parents
Mm-hmm.
wear them or whoever they're with, they're wearing a
Mm-hmm.
mask, but the kids aren't. So should kids also be wearing some type of mask?
I believe that they should. I understand that some people believe that because we have a younger population, if they do contract the disease, they are less likely to get severely sick. But I think just to be on the safe side, the kids should be wearing a mask as well. If not, then keep them at home.
And what about your hair too? Because we're also hearing that you can
Hmm.
contract it through droplets that are coming in your hair.
Absolutely. Make sure that you wear a cap. Make sure that you wear a scarf, something over your hair. If you are able to go home and wash your hair, I would definitely do that. And also going on with just it can enter through your clothes, not enter through your clothes, but it can be on your clothes and it can be on your shoes before you get in the house after coming in from the grocery store, wherever you went. Make sure that you take your clothes off at the door. Make sure you leave your shoes at the door. Go ahead and jump in the shower. If you're not able to do that, at least change it to something else, because you don't want to have the virus all over you, and then you're sitting on your couch or you're laying down in your bed, and it's going to just be a triple effect as far as the transmission of the disease.
And you just touched on this a little bit, but what is your routine like when you are going to the hospital and then coming home?
When I'm going to the hospital, I make sure that I sanitize everything before I put it on and going to get into my car. I make sure I sanitize my steering wheel, my phone, my watch, and my badge. When I get to the hospital, I immediately wash my hands, just coming from my car to the hospital. And then I get done with my shift. When I'm about to get into the car, I take off my shoes. I put on some flats or something. I lay down a covering in my car to sit on. I sanitize my hands. I sanitize my steering wheel, my keys, my badge, my watch, anything that I'm going to touch. And then I get started, on my way home. And then when I get home, I strip down literally in the garage or on my front porch, wherever, and then I immediately get into the shower.
Are there any places that we need to be avoiding right now or just being more sensitive at this time because I know a lot of people are going to parks and are going on
Mm-hmm.
trails where right now that's the hub where everyone is going
Yeah.
because that's really where we can go and feel somewhat safe since it's outside. So are those places okay right now?
Um, I know, like everybody else, because I'm one of those people. I want to get out. I want to get some fresh air. I want to see my friends. They are saying that the COVID can live in the air for up to 3 hours. So if you have to go out, just make sure that you're being covered up. I would avoid places like, honestly, like Walmart, grocery stores where there is a lot of people just coming in. I like to monitor the parking lots right before I go in. If I see too many cars, I just try to avoid it. So if you can try to get up earlier, go when there's not a lot of people there. Just try to avoid crowds as much as you possibly can.
Because let me tell y'all. So a few weeks ago, Ashley literally came through the phone and whooped me because I had just come back home from a little like social distancing picnic. And I was like, yeah, I just came back from this picnic outside. We're at the park. And she was like, what are you doing? And so ever since then, I have not gone to a park,
Oh,
trail. I'm keeping it in my neighborhood where so far
yes.
there's not a lot of people walking. I kind of gauge it out as far as times, but for the most part, to step, in my backyard or front yard or, so I can get some sun. But I'm avoiding these overcrowded places because I know my friend wouldn't want me to be there. So.
Yes, thank you. Thank you for that.
So, what are you doing during this time to stay sane, to keep some self care going on?
I'm definitely just going outside, going out for a walk, walking my dog, binging on Netflix, just taking a nap, just to like silence everything, talking with friends. I try to do everything but listen to the news about COVID because it's everywhere, and it really makes it makes it harder to leave those things at work because you want to just leave all of the depression and the negativity that comes along with COVID and treating people with COVID and what you saw, that day, and then just to come home and release it all. I try to do everything I can to just make sure that I'm free of anything that has to do with the healthcare system and COVID. So that's my self-care routine.
And what have you learned about yourself during this time?
What I've learned is that I'm stronger than I thought I was. And then I've also learned to be more present because these times they're so unpredictable. And it's sad seeing people coming into the hospital who are unfortunately not leaving because they died of the coronavirus. And so just to appreciate every day and to appreciate where you are right now, that's the most important thing. And that's something that I never thought about because I'm always on the go. I'm always like, what am I going to do next month, next week? And so through this whole process, I've learned to just value the time that I have right now.
Thank you so much, Ashley. And I think this conversation is well needed, especially from a new nurse perspective, because I know it's tough, like I said, just kind of being thrown out there head first. And also, again, thank you so much for your time. Thank you all so much for joining us today for this episode of Conversations with Caleb. Again, thank you, Ashley, for serving us on the front lines and being so selfless throughout this time because we know it's tough. And stay inside. That's the best
Yes.
thing that we can do right now is to
Yes.
stay inside and flatten the curve because I want to hug my friend and I haven't hugged her in a good month and some change now. So I would like to get back to
Exactly.
that. So stay at home and stay safe and we'll see you soon.